So, good morning, everyone. I'm going to start off by introducing myself. I'm Cyril Jean Alulino from DSMLS 3C, and today we will be talking about miscellaneous bacteria. So, basically, this is just an overview of what miscellaneous bacteria is. So, what is miscellaneous bacteria? So, the term miscellaneous bacteria encompasses a wide array of microbial species that defy easy categorization into well defined groups. So, this bacteria exhibits diverse morphologies, metabolic pathways, and ecological niche. And so, this report will delve into their varied traits, characteristics, ecological roles, shedding light into their often overlooked components of their bacterial diversity. So, as mentioned, during this discussion, we will be talking about their bacterial morphology, their metabolic pathway, their ecological roles, and habitats. So, moving forward, bacterial morphology. So, miscellaneous bacteria exhibit a wide range of shapes and sizes, challenging traditional classification systems. So, from cocci to bacilli to spiralia, the morphological diversity within this group captivates researchers seeking to understand the intricacies of their bacterial forms. So, what are examples of miscellaneous bacteria? We have Listeria monocytogenes, we have Streptobacillus moniliformis, we also have Calymatobacterium granulomatis, and so on and so forth. So that's just basically it for their bacterial morphology. And moving forward to their metabolic adaptability. So one hallmark of miscellaneous bacteria is their versatile metabolic pathway. So some thrive in extreme environments utilizing novel biochemical processes, while others display remarkable adaptability to varying nutrient sources. Examining these metabolic strategies provides valuable insights into bacterial survival mechanisms. So what does this mean? This basically means that miscellaneous bacteria are characterized by having diverse and adaptable ways of obtaining and utilizing energy. Their metabolic pathways are flexible and it is varied. So moving on in our next slide, ecological roles and habitats. So most, if not all, miscellaneous bacteria are extremophiles. So thriving in environments considered inhospitable to other life forms, from the deep ocean floor to acidic hot springs, these bacteria challenge our understanding of the limits of microbial life. What does this mean? So basically, extremophiles, they are considered to be extremophiles. Most of the miscellaneous bacteria are extremophiles, which means that they are capable of surviving extreme temperature, acidity, alkalinity, and other chemical concentrations. Now, are miscellaneous bacteria opportunistic? So the opportunistic nature of miscellaneous bacteria can vary widely depending on the specific species. So some miscellaneous bacteria exhibit opportunistic behaviors. Take note that is some, taking advantage of compromised host defenses or altered environmental conditions to cause infections. For example, a certain bacteria within the group may opportunistically infect individuals with weakened immune systems. So that's the time they become opportunistic. However, it is important to take note that not all miscellaneous bacteria are necessarily opportunistic pathogens. Some may have symbiotic relationship with hosts or play roles in environmental processes without causing them harm. The opportunistic behavior of bacteria often depends, so it just usually depends on factors such as the host susceptibility, the presence of underlying health conditions, and specific mechanisms employed by the bacteria to establish infections. Now, lastly, it is important to understand the opportunistic potential of this miscellaneous bacteria to assess their impact on human health as well as for developing strategies for prevention and treatment when it is necessary. So That is just basically it for the introduction of miscellaneous bacteria.
Good day everyone, I'm Angeline Castellano and today we will be discussing the Streptobacillus, specifically Streptobacillus moniliformis. Streptobacillus moniliformis is a highly pleomorphic, so meaning it has a form and also a filamentous, gram-negative, non-motile, and non-acid fast rod. Streptobacillus moniliformis causes a type of rat bite fever. It usually appears straight but may be fusiform, may develop characteristic lateral bulbar swellings, and the organism is typically arranged in chains and loosely tangled clumps. So next is the source of infection. Any person who is exposed to the bacteria that cause rat bite fever is at risk for getting the diseases. Some people who may be at increased risk includes live in rat-infested buildings, have pet rats at their home, and work with rats in laboratories or pet stores. So there are several ways people can get rat bite fever. The most common includes bites or scratches from infected rodents such as rats, mice, and gerbils. Another is handling rodents with the disease even without a bite or scratch. Also, consuming food or drink contaminated with the bacteria, and rat bite fever is not spread from one person to another. So moving on, it is proved that the portal of entry of the bacilli in feeding is not the intestine, but the throat and mouth. So incubation period. After the exposure, the incubation period ranges from 3 days to over 3 weeks, but typically is less than 7 days. Many patients report symptoms of an upper respiratory tract infection during this time. If a bite has occurred, it typically heals quickly with minimal residual inflammation and no significant regional lymphadenopathy. So proceeding in the infectivity period, at disease onset, fevers begin abruptly and may range from 30 degrees Celsius to 41 degrees Celsius. Fever may resolve in 3 to 5 days but can relapse within 2 to 4 days after fever onset. A maculopapular rash may appear on the hands and feet. This rash is identified by flat, reddened areas with small bumps. One or more joints may then become swollen and red or painful. As rat bite fever progresses, over 50% of patients develop migratory polyarthralgia. So as you can see in the picture, it is an example of polyarthralgia, which is persistent pain in multiple joints, or it has a swollen joints. The reported incidence of rat bite fever caused by S. moniliformis from laboratory rat bites is low. Of 65 cases of documented rat bite fever since 1938, only 8 or 12% were attributed to a laboratory rat exposure. So S. moniliformis may also be acquired by handling of the animal or by exposure to its excreta or saliva. So this is all my part, and Ms. Reyes will continue the further discussion. Thank you.
Hello everyone, I am Laarni Pearl Reyes and I'm going to continue to discuss the Streptobacillus moniliformis. So these are the clinical symptoms of those patients that has rat bite fever. First is headache, fever, muscle pain, joint pain, rash, nausea, vomiting, sore throat, and severe male gas. So as you can see on the picture, that foot has a rat bite fever. On the left side, it has petechial and purpuric lesions on the foot, and on the right side, it has the hemorrhagic vesicles on the first and third toes of the patient with advanced rat bite fever. So let's go to the microbiological diagnosis. The gram stain smear of S. moniliformis on blood agar medium demonstrates pleomorphic gram-negative bacilli in chains and clumps with irregular lateral and bulbar swellings. In media, optimal growth requires trypticase soy agar or broth enriched with 20% blood, serum, or acetic fluid. In culture, the bacteria grow slowly to 2 to 3 days and may take as long as 7 days. Typical colonies have a cotton ball appearance on media, while colonies on agar appear circular, convex, grayish, smooth, and glistening. And after 5 days of growth, some colonies may demonstrate the fried egg appearance seen with the L form. 0.05% sodium polyanisole sulfonate that is added to most commercial aerobic blood culture bottles as an anticoagulant inhibits the growth of S. moniliformis at a concentration as low as 0.0125%. Fatty acid profiles obtained by gas liquid chromatography together with characteristic growth can be used for rapid identification of S. moniliformis. So these are the specific treatment. The treatment of choice for proven or highly suspected cases of rat bite fever is penicillin. Test of S. moniliformis antibiotic susceptibility by the disc diffusion method usually demonstrate these following: sensitivity to penicillins, cephalosporins, carbapenems, aztreonam, clindamycin, erythromycin, nitrofurantoin, bacitracin, tetracycline, teicoplanin, and vancomycin. Those adults with rat bite fever should receive 240 to 360 milligrams of intravenous penicillin for at least 7 days. But if no response is seen within 2 days, it should be increased to 720 milligrams. And in children, they should receive 12 to 30 milligrams per kilogram per day of intravenous penicillin for 5 to 7 days, followed by 7 days of oral penicillin for 25 to 50 milligram per kilogram per day, maximum 3 grams per day, divided by 4 times per day. Both streptomycin and tetracycline appear to be effective, but erythromycin use has not been successful with treatment. These are the preventions. Avoid contact with rodents or places where rodents may be present. Avoid drinking milk or water that may have come in contact with rodents. Drinking pasteurized milk and water from safe sources. And if you handle rats or clean their cages, you should wear protective gloves, practice regular hand washing, and avoid touching your mouth with your hands. And that's all for Streptobacillus moniliformis. Thank you.
Good day, everyone. I'm Vidal Benedict, and I'm with my partner Mefrano Matthews, and we will be talking about Spirilium. So the general characteristics of this bacteria is they are all generally corkscrew in shape. They're similar to the genus Spirochetes, but unlike spirochetes, which are malleable in form, Spirilium are rigid in their form. And one of their morphological characteristics is that they have flagellas in both polar ends. Unlike the spirochetes, who has one flagella in its central body.
So, some of its characteristics. First is it is gram-negative. It is motile. The helical cell with tufts or whip-like flagella at each end. It is aerobic and microaerophilic, and it is 60 micra long.
So one of the significant species of this genus is our Spirilium minus, also commonly known as the rat bite fever, or also known as Sudoku. Individuals commonly acquire this bacteria through contact with rodents, so usually from your rat bites. There is another species of bacteria that is also known by this name. However, those are Streptococcus bacteria. An individual may also contract the infection by ingesting food or water that has been contaminated with the urine and droppings of rodents that harbor this bacteria. This condition is known as Haverhill fever. Now, diagnosing this would be hard since the only biochemical test that we have is its gram negativity. However, if we look at our specimen under the microscope, it's usually almost like a noodle shape.
So the pathogenesis of Spirillum minus, the bacterium causing rat bite fever, involves transmission from rodents to humans through bites or scratches. After entry, the bacterium can cause localized infections leading to ulcers or abscesses. It may then disseminate systematically, causing symptoms like fever and muscle aches. The immune response is triggered, but if untreated, complications such as joint pain and endocarditis may arise. Early diagnosis and antibiotic treatment are crucial for managing the infection.
Next species are Spirillum volitans. However, not a lot is known about this species, except that it belongs in the genus Spirillum and it's characterized by its helical and spiral shape. It is also one of the biggest bacteria that we have in this genus. It's motile and often possessing a flagella that is in a corkscrew shape.
So that
Good day, my name is Naimi Sitabola and the bacteria would be Gardnerella. Gardnerella vaginalis. General characteristic of Gardnerella vaginalis, it was first described in 1953. It is the only species in the genus. It is a short, pleomorphic, gram-positive rod or Coccobacillus, and in stain is gram-variable or gram-negative. So it has a gram-positive type of cell wall, and the peptidoglycan layer is thinner than found in other gram-positive bacteria, such as Cryonibacterium and Lactobacillus and Gardnerella vaginalis. It is also found as a normal biota in human urogenital tract. Clinical infections. So it is known for its association with bacterial vaginosis in humans. So bacterial vaginosis is a polymicrobial disease in which Gardnerella vaginalis and other bacteria such as Prevotella species, Peptostreptococcus species, Porphyromonas species, Mobalinco species, Atopobium vaginae, Mycoplasma hominis. Bacterial vaginosis characteristic is malodorous discharge, and the vaginal pH is greater than 4.5, and the vaginal discharge is fishy odor. It can use with test. So for years, G. vaginalis was thought to be only cause of bacterial vaginosis. However, the organisms can be isolated from 40% of the women without bacterial vaginosis. So the reduction in lactobacillus population in the vagina is followed by increase in vaginal pH. These result in overgrowth in by Gardnerella vaginalis and other bacterial vaginosis associated organisms. So Gardnerella vaginalis can also play a role in UTIs in men and women. It has rarely been isolated from other clinical sources such as blood cultures or wounds, and the drug of choice to treat bacterial vaginosis is metronidazole and also clindamycin. It is often used. Laboratory diagnosis. Microscopy gram staining of vaginal secretion. It is the observation of clue cells, large squamous epithelial cells with gram-positive and gram-variable bacilli or coccobacilli clustered on the edge. So lactobacillus rods are absent in the wet mouth. And Gardnerella vaginalis is often appears as a pleomorphic gram-variable Calcobacillus or short rod. In cell stain, it is gram-negative, 1.5 to 2.5 micrometer in length. Stain smear are examined and scored for the presence of Lactobacillus, Gardnerella, and Mabalincus morphotypes. In addition, glue cells can be visualized in wet mounds and vaginal fluid when bacterial vaginosis is suspected.
Good day, everyone. I am Janrain Pirimilano, the second reporter. For the continuation of this topic, we will proceed to laboratory diagnosis of Gardnerella vaginalis. Gardnerella vaginalis is often cultured on blood agar or enriched media containing blood because it benefits from the nutrients present in the blood, such as hymen and NAD. The characteristic appearance of Gardnerella vaginalis on-sheep blood agar is typically small, grayish, and translucent colonies, and it is fastigious growth for requirements. Other isolation media, a non-selective media, is chocolate agar. So, chocolate agar is not typically used to isolate or identify Gardnerella vaginalis. Instead, G. vaginalis is commonly cultured on specialized media such as selective agar, like Columbia agar supplemented with 5% sheep blood, and antibiotics such as colistin and nalidixic acid to inhibit the growth of other bacteria. Chocolate agar, while a versatile medium for cultivating various bacteria, is not specifically formulated for G. vaginalis and may not provide optimal condition for its growth and isolations. So, if we use human blood for the culture, we will see some beta hemolysis. So we need to use 5% of human blood for beta hemolysis. So, in this table, we will see the characteristics of Listeria, Corynebacterium, Erysipelotrix, and similar gram-positive bacilli. So, this organism, first is Corynebacterium species. Their catalyst production is positive and their motility is negative. Escholine hydrolysis is vulnerable and acid form glucose vulnerable. HS from TSI agar is negative and hemolysis type is V. Listeria monocytogenesis, their catalyst production is positive and their motility is positive. Escholine hydrolysis is positive and acid form glucose is positive. Their HS from TSI agar is negative and their hemolysis type is beta. This erysipelotrix roseopathy is negative, catalyst production and motility is negative, escholine hydrolysis is negative, and the acid from glucose is positive, and HS from TSI agar is positive, and for hemolysis type is non-alpha. And for the Arcanobacterium hemolyticum, their catalyst production is negative, motility negative, negative escholine hydrolysis, and positive acid from glucose. And for the HS from TSI agar is negative, and hemolysis type is beta. Gardnerella vaginalis is negative in catalyst production, negative in motility, negative in hydrolysis, positive in acid from glucose, negative from HS from TSI agar, and none in the hemolysis type. And for the Rhodococcus species is positive catalyst production, negative motility, negative hydrolysis, negative acid from glucose, negative HS from the SI agar, and none for the hemolysis type. And for the last is Ruthia dentocariosa. for their catalyst production is positive and motility is negative, and for the esqualene hydrolysis is positive. Positive acid from glucose, negative HS from TSI agar, and for the hemolysis type is none. HS hydrogen HS for hydrogen sulfide, T is I triple sugar iron, B is variable, positive present or positive, negative absent or negative. Motile at 25 degrees Celsius, and B hemolytic on human blood agar, but non-hemolytic or sheep blood agar. So we will proceed to characteristics of Gardnerella. There is a human blood P layer twin agar. It is small colonies with B hemolytic, and for the oxidase, the result is negative. Since G vaginalis is oxidase negative, there won't be color change in the test. So for the catalyst, the result is negative. Does not produce the catalyst enzyme, and due to the lack of the catalyst enzyme in this bacterium. So for the hyperate hydrolysis, the result is positive. Positive result is indicated by the development of a deep purple color or a very visible precipitate. And for the last is starch hydrolysis. The result is positive. So this is for the last slides of our topic. Thank you for listening.